Dear Madam, Sirs, and dear students, my name is Minna Jaakkola. I'm a communications manager and a project manager, and I'm about to give you a lecture about leadership and technology in supporting staff and client participation. I've been working in a digitalization project called eCountryside for 2 years now. It is a project which enhances the digitalization of services in rural and sparsely populated areas in the county of Northern Savo. It has funded small pilots from 3 to 6 months of duration in order to introduce new technological tools and digital processes into practice. The project it is not specialized into healthcare, but it has carried out several pilots in the healthcare field, and I will introduce them to you shortly. The pilots we have carried out in the social welfare and healthcare sector are facilitated peer support group for informal carers online via video, sensor technology in home care, medicine reminder, which is a digital tool in home care, speech recognition in patient recording, online sessions for alcohol and drug abusers and their families, and musical recreation moments for nursing homes online interactively. Um, the project has also made uh, several trips to our neighboring countries, for example, Denmark, Estonia, and Sweden, which, in my opinion, are far ahead of us in reforming um, healthcare, and they have carried out several digital pilots, and they have reformed the way of social care and healthcare. And these are the background information we have gained from Denmark, for example, and the reason to reform the ways of organizing healthcare has been, for example, the people getting older and older. Also, the potential for cost savings that digitalization has been a major reason to reform um, the healthcare sector. Um, the Danes had this kind of slogan of pushing, helping, and caring, and these are the experiences from our pilots. In our pilots, it has been proved that technology is still somewhat immature, but it is more ready than the transformation of organizations to new digital era. We have learned that the transformation is more about psychological change than technological change, and it takes time for people to reform their ways of working. Communications is a critical tool in the digital transformation. If it is not clear to the staff why reform is taking place, they are not committed to the change. Also, it is very important for the working people to inform the bosses and the decision makers how digital tools um, are adapted to the field and which kind of results are gained, so that the investments have more support on the background. We have learned that there is risk of making of doubling the work if the old model is paralleled with new model, and in this case also the costs are doubled in organizations. So we must get rid of the old way of doing when introducing new. We have learned about change resistance in the staff, and we need a lot of talk and conversation and support to people, also in the means of education, in order to relieve the attitudes taking place. Major findings in the field of digital reform in the whole of Finland is that the will to invest in new technology, in particularly in rural municipalities, but overall in general, is quite low. We do not have enough evidence of cost efficiency to reassure the leaders or decision makers. We do not have enough brave forerunners in municipalities to give an example for others. Even laptops or modern cell phones are not something taken for granted in the field of healthcare, and this, I think, is a very serious detail to be um, taken care of. The digital development that takes place in Finland is distorted and it is very fragmented. We do not have state control as Estonians or Danes have, and we lose a lot of municipalities' tax funds into simultaneous and parallel development. Experiences in municipalities are not shared nor taken advantage of. We are not co-creating a whole entity, but a digital puzzle of programs, bits and parts that do not fit together, and it complicates the work of professionals. It is very expensive and it makes the services very unattainable for the customers. I think that the biggest change takes place in ourselves, in workers. Um, the prevailing attitude is that the demand to enhance the digitalization, which we all face, creates an existential crisis in organizations and workers. One fears losing his job or position. In research that Professor Helena Melkas has made in the city of Lahti 2016, they found out that elderly people had more positive attitude towards robots and new gadgets than the professionals had, and this is something we really have to work on. What we need in the future is more pilots, more tests, and more demos that can be transferred after testing period into practice. Organizations will be living labs and test beds all the time. The change is here to prevail. We need new leadership skills, leaders that want to lead the change. It requires better communication skills in an organization, a lot of talk and conversation of why are we doing this, why are we reforming our ways to work, better evaluation of results, and the courage to lead the change and to be an example for masses of municipalities that hasn't even started to renew their models. We need more education and motivation for our workers in the healthcare field. We need conversation of how my work could be more meaningful and how could I make it easier for myself and more attractive to myself. How can I be the developer of my own work, learn new things, and add more meaning to my work? Which kind of assisting tools should I require to make my work more efficient and more easy to do? I'm encouraging you to be the myth buster of old inefficient routines, to have the courage to doubt the ways we are working at the moment. I am encouraging you to renew our thinking in order to provide new results, and I'm encouraging you to take a courageous glimpse towards new era. Thank you for listening.